Hello, everybody, and welcome along to another one of these BTPA, the Bowen Therapy Professional Association interviews with myself, Ben Calder. And I'm really lucky to be here today with Jonathan Damonte. And he's, although he's in Mexico at the moment, he's a Canadian-based Bowen teacher who qualified all the way back in 1997, if I've got my information right, and has been teaching all the way since 2002. And I'm especially interested to talk to him today because he's got a really big interest in homeopathy, and he is a registered homeopath, and has been involved in the founding of Bowen Canada and the Bowen Therapy Clinics, the North American Bowen Teaching College, and Bowen Online. So I'm looking forward to a really good conversation here today. Jonathan, thank you for joining me.
Pleasure. Great to be here. Thank you, Ben.
Cool. Thank you. And it's been really important, I think, for us to start to bring together some of the more experienced and higher profile teachers across the world and just start to hear about where you are, what's really important, what's really alive for you all at the moment in terms of your work. But before we start getting into the nitty gritty and the depths of it, for anybody that's maybe not come across you and your work before, could you give us a bit of a potted history about how you got to where you are today, what got you involved in physiotherapy, in physical therapy, and what was your introduction into Bowen Technique as well?
Oh, great. Yeah. So in 1997, I started my homeopathic practice. And in that practice, in the clinic, was a Bowen instructor named Manon Bolliger. And she had just taken the first weekend of Bowen training and had started to use it in the practice. And any physical ailment was referred to her because it was a way of opening the door to treating a more chronic case. And after a couple of years, I moved to another city, and many of my clients wanted me to learn Bowen therapy so that I could treat them with Bowen therapy as well. And I was very reluctant to become a body worker. It was not my training. I was a homeopath. I was really into the practice of homeopathy. And reluctantly, I took a course. I learned from Ozzy Wrench and Elaine, and that was my first training. And I just pretty much faked it till I made it, like a lot of us. And it just took over my practice, in fact. I later became a teacher, and most definitely, Bowen therapy was the driver of my clientele coming to my clinic. And as a homeopath, working as a Bowen therapist, it's an interesting position because there are many advantages to applying homeopathy in treating a case, whether it's a frozen shoulder or a sciatica or a jaw problem or a seized back or neck. You really want to find an additional support for that patient where they would apply that support in between visits. And I do believe that it enabled my practice to really flourish. And I had great results as a result, I think. Not just because Bowen is such an amazing therapy, but I was able to support my patients in between visits. And it taught me a lot. As a homeopath, you learn to do a lot less. You're giving such a small amount of medicine that you apply that same philosophy into your Bowen therapy as well. And I think that the two philosophies mesh very well. So at one point in my clinic, I had a clinic with 4 treatment rooms. And, as a Bowen therapist, you know how fast you have to run between each room, even though you're giving your patient a lot of pause. And then to add in the choosing of a homeopathic remedy forced me to search for more efficient ways of prescribing homeopathy. And that's now where my focus is in teaching, is not only teaching Bowen therapy, but also teaching homeopathy to be done quickly and reliably. So I'm excited about this turn in my career. And now that I've been in practice almost 30 years, it's a time when your knowledge needs to be shared. So I'm enjoying doing that as well.
Beautiful, thank you. It's something that I find really interesting as well, because I remember in my initial Bowen training here that there was still very much this idea that combining modalities was frowned upon, and that about the only thing that was comfortable for Bowen technique was homeopathy. And that was as much as was said about it. And by that point, I'd already been a kinesiologist for 10 years, and kind of understood multidisciplinary approach in a very different format because of how kinesiology allowed me to access that, and had worked with homeopathy a lot. And so I found it kind of interesting. There was kind of like this slight cap doffing to homeopathy, but then there was nothing else in there. So when you're actually teaching Bowen, are you bringing all that knowledge about homeopathy and about how to decide what remedies might be appropriate into that with your students?
Yeah, I mean, to a small degree, I'm beginning to do that. However, homeopathy really requires a broader foundation in knowledge from its philosophy and how you manage a patient with homeopathy. So that's really requiring me to create a separate course. And however, what is important is to be able to integrate the intake that you do with a patient and use the same information that you use as a homeopath as you would for a Bowen therapist. That you're really understanding the totality of the person's expressed symptoms. That, you know, that migraine is not isolated to the symptom itself. It's going to be founded in another area of congestion, be it a structural congestion or a functional congestion, like a hormonal issue, or a inflammatory response to certain triggers of stress or weather or whatever it might be. That enables you as a body worker to expand your intake. And I think it makes you a better physical therapist to use a little bit of the homeopathic philosophy of uncovering the story of the symptoms and seeing the totality of that. What's interesting about homeopathy and Bowen therapy is that the issue of protocols. In Bowen therapy, I've come across now quite a lot of protocol driven practice. And what I'm now teaching a lot more is how to individualize your treatment per individual, not only based upon their condition, but also on the element of their vitality, their ability to respond to the stimuli that you provide them, be it Bowen therapy or any other modality. That you're really following the nuanced reaction to enable your choice of treatment. And sure, protocols are great. I mean, we all know that treating sciatica requires a certain number of protocols in order to do that with Bowen therapy. However, in what order and in what pace is the important question. And I think as a homeopath, I've really learned how to do that more efficiently. And, I mean, Bowen therapists across the world have learned different levels of different techniques in a sense, how to use those Bowen methods, Bowen procedures in different forms, in different numbers, in different sequences. And there isn't much rhyme or reason to that, except when you break it apart based upon the patient's state as they present. So I'm very keen on teaching the rules of Bowen because they're good guideposts in a general sense. However, they really need to be broken much more. And it's a tricky balance to instill on a new student the amount of time that you might give for a pause and for what reason and what validation for that amount of time versus just throwing in a protocol of X, Y, and Z. So it's a tricky balance. And I think the foundational philosophy of homeopathy really enables me to convey rational reasons for the application of Bowen therapy in a clinic setting. When I think back to when I had 4 rooms, it was very manageable because many patients would come and need, a 15, 20-minute pause. So it enables you to continue a story or a treatment plan with another patient in another room. It was very, very feasible. And we know how the originator, Tom Bowen, would see many, many people at the same time. And I think I encourage my students to do the same. I sort of lost where your question was, actually.
No, that's perfect. Thanks, Jonathan. I wonder if you could just try and summarize for us what you see as that philosophy within homeopathy, and what especially is it about that you see dovetailing into, if you like, the philosophy of Bowen technique?
Yeah, so it's not the technique itself that is treating the patient. It is the response that you're engendering, that you're facilitating as the therapist. You're allowing the body to remake its state of reaction to its condition. And in the same way, with homeopathy, you are freeing the body's function by antagonizing it with a substance that is basically an analogous disease matching the disease they have. So it's like an inoculation of the very problem they have. Not an inoculation to the disease, but to the state of reaction that they are stuck in. And I think for many, many students, the biggest hurdle of learning is observing where are the stuck patterns and what are they treating. And we tend to, in medicine, be reductionist and treat the condition. So we have the shoulder procedure and the protocol of treating it in part during let's say a month. We might treat the shoulder 2 times. That's what we're commonly taught. However, if you really break it apart and understand how the patient is responding and follow that, you might find another sequence of treatment to be much better. And so if you are learning to be more observant to your patient's reaction, you're able to follow when and how to intercede and be more effective as a practitioner. And so, the rules need to be thrown out at times. I mean, there are times when I'm treating a bulging disc with a patient who's crippled by pain. I might see them and do a couple of procedures only for the first visit over a very long period of a session, and then maybe even see them the next day if it's needed. If it doesn't hold, why not? If the treatment was effective and you weren't overworking that patient and they had a good response, why not reinforce it sooner than we're often advised as Bowen therapists? So if you want to break rules, you have to have a reason for it. And that is true for any practitioner that brings in another therapy. Whether you are a Thai massage practitioner doing Bowen therapy or a physiotherapist in a hospital setting, you're going to have to break the rules anyway, so just for the sake of time and the patient load that you have. Why would you not use Bowen therapy to its best advantage if you can fit it into your otherwise restricted paradigm of practice? So I think
Wow.
having a sense of freedom based upon a rational reason gives a Bowen therapist a lot more scope in the way they use the procedures.
I really love how you sum that up. That I love the very idea, just that it's not about the technique, but about the response as well. And it's really inviting us as practitioners to pay far more attention to what changes it is that we're creating as we create them as well, rather than just going in, doing a thing and leaving it and kind of thinking that that's no longer anything to pay attention to. And, those skills in palpation to be able to, and for me, that's not just a touch thing, but also what am I observing, visually? How's the patient's breathing changed? What are the changes are going in there? But I'm kind of curious as well within that. One of the things that I've found within this series is we're getting this information and these awarenesses because of the length of time and the amount of treatments that we've conducted, and so that body of experience has built up. So I'm wondering, at what level do you think the amount of self-awareness in the practitioner and how much work that they've done on themselves, how aware they are of themselves, how much that affects those outcomes?
Well, I think it's very relevant. If you, well, I wanted to touch on one aspect of my practice that I've really emphasized in my teaching as well, is how to follow the response of the patient. And you talked about many of those aspects. And one of the key elements that I use is the way I can perceive temperature changes in the body as I'm working on it. That sense of heat that arises during a session in an area requires me to release or free it so that the temperature is reduced to normal. We all are taught when we learn the kidney procedure to hold a hand over the body and perceive that. Well, why not anywhere in the body? And that's something I use a great deal. And I think it's a very important element in how you apply protocols during a session. And then when it comes to perceiving the patient's understanding of their own state, is very valid. I mean, Bowen therapy as a diagnostic tool is tremendous. I mean, when a person's cartilage in their hip joint is shot way before they would get a referral for a CT scan or an X-ray even, just based upon how it responds. You can tell what sort of condition that hip joint is in by the fact of it responding but not holding, for example. That's a very important element as well that Bowen therapists should explore more, that you are able to diagnose what is going on with the injury. I mean, even in a shoulder, for example, is another example of understanding when there's a tear that is needing surgery or perhaps just being rehabilitated with specific exercise, rather than leaving it as a blank, oh, we just need to continue Bowen therapy because it helps. When it doesn't hold, it's really raises a big red flag and an important question for you as the practitioner as to how you're going to get a better diagnosis of what's going on, so as to manage the case better. And then another area for me as a homeopath that is important is that in homeopathy, there's a very strong element of understanding the emotional and mental state of a patient in order to prescribe a remedy. Well, as a Bowen therapist, I've learned to use the physical cues of the body's state of reaction to choose a remedy. And lo and behold, that remedy will often, in fact, always, I would say, when it's a successful remedy, match that mental and emotional state. So that is my simple method in practicing homeopathy, is to not use the mental, emotional story of the patient, not because it's not important, but because it takes such a long time to elicit. And I'm using the body's expressed symptoms to shortcut that process as a homeopath. So if anyone's used homeopathy, you'd understand what I'm talking about. And it's a tremendous revelation that you can use the body's expressed symptoms to find the chronic treatment using homeopathy. And using that as a doorway into the patient's awareness of their state and confirmation of their state is really a beautiful process as a practitioner. When you can touch on that emotional block, that holding that they're stuck in, and help them free that by explanation and discussion, and then even reflecting back your awareness of it to them. So it's a beautiful process.
And I think that's somewhere as well that, again, Bowen is very much, as it's taught, a physical therapy. And, thanks to Descartes and his agreement with the Pope many years ago, this idea of body and mind being separate has perpetuated in medicine way longer than it should have done. But I think we're coming full circle with that now. And certainly for me within my practice, I use integral theory as a backdrop for how I look at the world. So the mind and its beliefs and emotions, the body, its behavior, its functionality, our relationships, our environment, they're those irreducible quadrants that we can never be separated from. So they all have to play a part somehow in whatever it is that we're experiencing when we're with a new patient. But I'm wondering for you, how often do you find that those emotional factors are key in why that physical debility is not repairing itself and why somebody isn't moving on?
Yeah, I would agree with the statement 100% that there is often um, a treatable state of emotional response. And how we approach that is going to be individual for you as a therapist. I'm not a psychotherapist. I'm not an emotional release person. I'm not. I don't do that. And the reason I don't do that is because I don't want to infer my idea of their state, but I want to confirm it. And that would come about through discussion. So, as an example, you have those simple cases where the person's in a neck spasm and or shoulder spasm, and you really find out, well, what's been going on. You find out very simply, well, I have had this stress and so on. However, when it's a much older pattern, you can't just dig into the psychology right away.
Hmm.
You can't just jump into your idea of what it is. You have to unravel the story in a way that the patient can freely express it and allow them the space to express it. And a lot of people are very guarded in their trauma. They don't want to come and talk to you. They want to come and have it worked on, the symptom worked on. So there's a lot of reasons that I don't dig into the story as I would have done when I first started practicing. And the reason is because I can depend on other cues in order to free that stuck state, so to speak.
Yeah. Well, that's good to know as well, because my thoughts within that were immediately about how do we know that the persona that's representing the story is giving us accurate information. But when you're, as you say, using those other cues that the body is providing for us, and I find that the body is the least likely to misrepresent what's going on. I don't know what your thoughts on that are, but it really helps us then look at the congruence between the story that's being spoken and the physiological result that it's creating.
Yeah, I would agree with that statement. So sorry, the line is breaking up a little bit. So
That's
clear.
okay, Jonathan. Yeah, we're having a few breaks, but it's all right.
Okay. Um, yeah, I mean, we all are going to perceive in the way that we're trained to do so. And therefore, being a better Bowen therapist doesn't mean learning how to perceive differently. It means it means um, being confident ensure that what you are perceiving is really true. And you can't infer as a Bowen therapist, nor as a homeopath or any other therapist. You have to take only what is absolutely true to be your foundation for a decision. And I think that becomes simpler and simpler as you gain experience. That it becomes a very innate process that you are in touch with not just their physical expression, but the potential for a bigger story underneath. And you can definitely see those patients that have that. And it's surprising still to me that a certain archetype of person who seems so conscious of themselves and self-aware, yet it's such a different story underneath. And one of the truisms I always express in my teaching is essentially this: the bigger the story, the less we do. And I think for most therapists, that's a hard thing to adhere to. It's our innate nature to want to do as much as possible. And thankfully, as a homeopath, I've learned that the hard way to do less is always a better option. And then affirm that with Bowen therapy. So that's a great compliment. I've really enjoyed doing two modalities. In fact, I'm developing a course called Homeopathy Simplified. And originally it was going to be homeopathy for body workers. But then I decided to make it a complete course because you just can't learn a modality without learning all of its um, principles, philosophy, its history. And you can't understand how to make it simple until you understand its complexity. And that's true for Bowen therapy as well. You have to have a really clear anatomical knowledge. You have to have a clear pathological knowledge in order to be a good practitioner. And now we're learning even more how you have to have a high emotional intelligence to work with patients on that level as well. So it's not that you shouldn't use Bowen therapy without those, by all means. However, it's ultimately, if you're going to be the best practitioner, you really do have to expand your knowledge to a high degree. And fortunately for me, I fell into teaching, and that forced me to learn what I needed to learn. Perhaps I would have been more lazy and not studied as much if I wasn't teaching. So I think for teachers, they have a high duty to have a very broad knowledge.
It certainly is true that if you want to know how well you understand any subject, try and teach it, and you soon find out where the gaps in your understanding are. But I'm also curious as well, when you were talking earlier on there about avoiding inference within the process of the intake with the clients there. Could you give us an example of the types of questions that you use within that intake process so you're avoiding that, but you're still able to get hold of the information that for you is valid and useful in terms of how you're going to then move ahead with your treatment?
I think that first and foremost, you avoid leading questions.
Mm-hmm.
Don't assume that it's a stress. Don't assume
Mm-hmm.
it's a family issue. Don't assume it's a broken heart or anything along those lines. But be very general in your question and say, okay, so 3 months ago, your problem started. What else was going on at that time?
Yeah.
And not necessarily details, but how did you react to that situation? And so
Mm-hmm.
sometimes you can get the most important piece of information as being how they reacted, not what was the story of the cause. So, by example, this is my story. I broke up with my partner and I spent a week on the couch and developed sciatica. So it's really more about spending the week on the couch that was the problem, you know,
Yeah.
and being so frozen in my emotion. Of course, that expressed itself in my body. And then laying on the couch, eating popcorn and watching movies to distract myself was, part of the story. So the details were not the grief and the breakup. It was the fact that what I did afterwards. That was the story. And so that explains a lot. It's sort of a rough, I'm trying to think of another better example, but it's really how we behave intrinsically that is often a cause to our physical symptoms. And those physical symptoms, though triggered by an emotion, which comes first sometimes doesn't matter, that you have to free both aspects of that stuckness because the body is on or off. It's not so smart and nuanced as our emotional world. And that can be attenuated more easily. We can self manage our emotional state and make compensations. But our body is not as flexible in a sense, in that it is in that state of reaction or not. And what Bowen therapy does so well is switch off that pattern, just like a circuit breaker switch. And that's often what I'm telling patients. These moves, though small, are just as similar to the circuit breaker switch where we turn it off and on. And that's a reset for that fuse box. That is part of the physical structure that we want to remake its pattern of behavior. So, yeah, I think that the emotional part is such a big story. And if someone has a lot to discuss, I'll invite that. But I don't dig for it in my practice. I don't go digging and delving into their emotional world because that's also an invasion in a way and requires them to come up with that.
I think one of the things that we really see coming through in a lot of the modern understanding within trauma, and we look at people like Peter Levine, Gabor Mate, and the types of work that they're offering, and they're reinforcing this idea that for something to become trauma, it's about how that shock was integrated into ourselves and into the culture that we're sitting in at the time, and the story that we choose to tell about it. So I think it's so important to understand that simple pattern within people and how it can alter their behavior and therefore their physical bodies.
And so, would you, in your practice, how would you manage a situation like that? Just out of curiosity.
Any particular situation, Jonathan, or?
No, let's say a trauma that is, imprinted in their being.
Well, again, very similar to you. The first thing would be just to ask, how that's been for them. What is it that it's affected for them, and what they understand about it, what they know about themselves on the basis from that. And I often invite clients to tell me what they think they need. Because it's their experience, it's their lived experience inside their bodies. So it's kind of like, well, what is it that you need? What is it that you think that you're looking for that will create the change here for you? And then also because my main discipline is within kinesiology, I'll then allow the manual muscle testing to lead me in the direction. So essentially their nervous system is then giving that feedback. I might have my ideas and my thoughts about what I think could be involved in that. And I love the fact that in 21 years of practice, on a regular basis, thoughts and ideas that I have about how things are going to go is not how they go. And I've put that down over the years to looking at, well, there might be a priority of things that need doing. But it's also about that person's capacity on the day that they're with me. And, that kind of reminded me where you were talking about pace and order of technique. Just because you have an idea about what needs doing, it doesn't mean that you should do it in the order that you were taught to do it.
Yeah, I think it's well put. I mean, ultimately, to be a good Bowen therapist, you do need that level of sensitivity and listening and receiving their state. And one of the lovely things about being a Bowen therapist is that you do invite that, and yet you walk away from it many times during a session. And so you are such a neutral person involved in that therapy with the individual. And I think it's such an incredible element of Bowen therapy, that walking away and leaving the patient alone to their process and you not being involved in it. It's beautiful. Yeah. I'm not sure I have you on.
Yeah, we had a little pause there. That was we got you as far as walking away.
Oh, okay. What I was saying was that element of walking away makes you such a neutral
Mm.
participant in their process, and it's such an important um, element that they resolve their state themselves, not by you, not by you. You just create the environment for it, and if there is a resolution, it is a resolution. It's not something that they would depend on you for. You were not involved. You kept walking away. You kept giving them the space. And, it's a very magical process. I
Mm.
think it's completely unique. And it's similar to homeopathy in many ways, because when you think of homeopathic practice, you think of the sort of traditional sitting beside them or at a desk, consulting and going through their story, and it's almost very psychotherapeutic. However, when you integrate a homeopathic practice into a physical therapy practice, you're not as much in that psychotherapeutic state. You're also doing what the Bowen therapist does, creating space for that response and allowing a person to fully resolve their emotional part is helped by the homeopathic process of understanding that little bit more about their state of reaction, be it physical or emotional. So, yeah, I think homeopathy will be a very good addition in the training of Bowen therapists, whether you use it or not. I mean, it's not about the itself, it's about the process of creating a place for healing. And that definitely aids the process.
Mm. So I'm wondering as well, you talked about the sensitivity of the Bowen therapist there. And I'm just wondering, when you're teaching, how do you foster that sensitivity? Because we've got such a wide audience here, from the public to established practitioners to students coming through. So what ways do you direct your students to help them develop that sensitivity in the practice?
Well, you really have to see it with live cases and working with the questioning of how to manage a case is where you learn that sensitivity, that um,
And so, to kind of extend that question a little further, what do you wish that somebody had taught you when you were early on in your practice, and when you were learning these skills and starting to combine the Bowen and the homeopathy? What's become really important to the way that you work now, that you wish you'd understood better at those early stages?
waiting, absolutely waiting, and then seeing more clearly the hierarchy of a person's symptoms. I think we're broken here. We're reconnecting. Can you hear me, Ben?
Are you still with me there, Jonathan? We've had a little lag.
I've lost you.
Yeah, we had a little lag there, Jonathan. Sorry, I got you as far as
Going to go
hierarchy of
back to
symptoms.
that.
Oh, there's a drop out. It's just
Oh, I have you back.
yay,
So
brilliant.
the
So
question,
on that
can you hear
previous
me?
bit, we got as far as hierarchy. Yeah, I can hear you again, Jonathan. Thank you. I got you as far as
So what I
hierarchy of
was,
symptoms.
yeah. So understanding um, how to undo a person's state according to the hierarchy of the symptoms. And one philosophy that I'll share about homeopathy is that when a person heals with the treatment, they heal in the reverse order of the onset of those symptoms. It's happened again.
Yeah, we're still getting a little bit of connection loss there as well.
Yeah, I'm going to switch again the Wi-Fi.
Yeah, sure. It's okay, Jonathan. It's
Okay.
thankfully we're not live, so it's all right to play about there.
Okay. So what I was saying is that in the homeopathic philosophy, a, a person heals in the reverse order of the onset of their symptoms. So let's say a patient developed, had asthma as a child, and then they developed migraines. But at the same time, they had braces in their dentistry. That's a very common situation. And then later they developed a digestive issue. So in homeopathy, those symptoms would heal in the reverse order of their onset. So in a timeline reversal. And
Mm.
in one philosophy, you might think of that as um, a, um, a layer of symptoms, but they're really not. They're all just expressions of the person's state of imbalance and their possibility a to manage the symptoms they have, the conditions they have, in the best way possible. So, homeopathically, we see the person heal from um, the reverse in the timeline, and then from within outwardly, and even from the top down. And I think the same is true in Bowen therapy, that if you can think like that and treat the reverse order of the onset, you'll go far as a Bowen therapist. And that really makes you think, well, what is the most important symptom to treat first as a Bowen therapist?
Are you asking me that as a question?
Yeah, I think for any Bowen therapist, that's the question. What do we treat
Yeah,
first? And
yeah.
in a simplistic way, it's really as easy as the homeopathic philosophy to treat in the reverse order of the onset of those symptoms. And that will enable the body to unravel its state of reaction very quickly, very quickly. Because, even though you recognize deeper issues with a person, at what point are they ready to resolve those? It's a question you
Mm.
have to ask yourself. And so being sensitive to the the reality, just what you see, and going with a simple discipline of treating them in the reverse order will help you a lot.
Mm. I think that's a really good and salient piece of advice for all of us working with physical therapy as well, and it's a great reminder to have as well. I'm also curious as well. Where do you think, I mean, again, I'm gonna take a bit of a guess at it. I'm not going to be surprised perhaps by some of the answer, but I'm curious about where you think we should be looking to develop Bowen over the next 10 years, and where do you think we're not giving enough attention into the exploration of body work that we should be looking at a lot more?
That's a really big question, and I'm almost blank at where to begin. But I think that you know, one of the aspects of Bowen therapy that has, I think, dissuaded its uptake in the general world of other body work is how dogmatic it is.
Mm.
And I think that was a very big error in the way we teach and present Bowen. You know, giving instruction sheets of what not to do and how rigid we have become as Bowen therapists. I think I like to explain those rules and give justification for them so as to not be contrary to
Mm-hmm.
the general impression that teachers are giving. But I want to give freedom to break those rules much more and not have such a rigid view of what is Bowen and why it should be done a certain way. I think that does come down to the individual patient and, you know, mixing modalities, mixing therapies, that is rarely an issue, rarely. And the only thing you need to do is to be aware that it could be an issue.
Mm.
Um, Things like exercise. I mean, I have patients who have come to me from other practitioners who had a wrist injury, but yet weren't treated in
Mm-hmm.
their wrist for 3 sessions when, you know, they've come for a wrist injury. Why would you not address the chief complaint? Or they've been given instructions such as getting up every half hour.
Mm-hmm.
Well, it's only relevant if you have a specific type of condition.
Mm-hmm.
And so I'm being more reasonable with the logic of Bowen therapy and how a person heals or doesn't heal. And you know, I remember a patient who came for a wrist problem, carpal tunnel, and he came. He had originally come for a sciatica that resolved, and a couple of years later, he came for the wrist injury. And he said, "Is it okay if I go mountain biking tonight?" And I said, "Well, probably it's a bit soon." And he said, "Well, no, I've got to. I've got to go. I've got a big commitment for it." And so he went, and I didn't hear from him again for months and months and months. And then I did hear, and he said, "Oh, yeah, it was no problem at all. No problem." And that was early in my practice. And I learned from that that really it's not about insisting on him not doing something. It's
Mm-hmm.
not. It's about freeing his ability to heal, to change this pattern that he's holding. And that's often the case in Bowen therapy. We have to learn to wait and see what is the response to the treatment. And yet, we can have very high predictability with the outcome of the session as well. So that's a very hard thing to teach in therapy. You know, every body worker creates a formulaic process. In North America, at one point, it was, you know, chiropractors, for example, were scheduling their patients for 30 visits for specific conditions and saying,
Wow.
well, you know, if you don't do those 30 visits, it's not going to be a successful treatment. And
Wow.
we can't think like that as body workers. We have
Mm.
to have an eye on the response primarily, and then a kind of guidepost of how to manage that response and what is our expectation. And also having the cooperation of diagnostics to know what are the limits of this therapy in this condition and when other therapies might be or other interventions might be needed. So that comes with a lot of experience. And so, therefore, clinical pearls expressed in formats like this are so valuable. And I could see a need to present cases more commonly for Bowen therapists to really describe the intake, the state of the patient, the treatment plan, the actual treatment, and the outcome. Because it is so individual, you can't really do double blind research, which is very difficult to achieve
Yeah.
without a lot of funding. So that also needs to be done to validate Bowen therapy, of course. That's how the world works. They want scientific validation. But at the end of the day, the therapist thrives when they have success and when they have referrals for that success. And that's what is the most important element, really. It's up to the individual, and you really have to shift your mindset more readily as a Bowen therapist, because there are so many wonderful tools in the world of bodywork that we are not exposed to in our training and yet could be of such important value. So more integrated approaches would be helpful.
Yeah, no, that's wonderful. Thank you, Jonathan. I'm going to apologise to the teachers of all the disciplines that I've ever learned from here, because one of the things that I find it really important to do whenever anybody tells me there's a rule about a thing is to go and break it and see what happens. Because I found far too many times that the rules had stories, but they didn't necessarily have a decent basis. And so it was always good to understand, well, where is that rule really valid, and where is it something that certainly has a degree of flexibility. And of course, what you're alluding to here is contrary to a typical medical model, which is where all treatment is individualized. So we're really coming down to that person at that time and the situations that surround them. Even if we were looking at members of the same family, experiencing similar things, how they internalize that and what their response to it is completely unique.
Agreed. Agreed. Yeah.
Sure. So one of the things I also wanted to ask you about as well, talking about individualization, but slightly going off the topic, one of the things as I was looking a little bit more into your work that I found was you do a wonderful free handout, which is the 22 back remedies for body workers. And it comes with a diagram that, as a kinesiologist, my brain just loves stuff like that because it's that kind of, it's giving you choices and directions to move around. I'd really like to include a link for that in our video description today as well. But can you just say a little bit about how and why you developed that for body workers to use?
Yeah, so I wanted to communicate to people like yourself that there are really quick decisions you can apply based on the information you already have, maybe with a couple of questions extra, that would enable you to support your patient with a homeopathic remedy. And you know that having a crisis in your back can be completely debilitating and a desperate state for the patient. So you're, as a body worker, you want to support that work with an extra medicine, perhaps. Perhaps you give magnesium supplements or hot and cold packs or castor oil or whatever it is that you also apply in between your visits. And why not use a homeopathic remedy if you can define it really quickly and easily? And so this flow chart is probably about 6 questions that you would answer primarily with just the intake that you've already taken. And you might add an extra, well, which side do you lay on at night in order to be comfortable? That might be a question. Or do you prefer hot or cold, if at all? So very simple questions that would be very normal in relation to their back problem will enable you to choose a remedy. And then also there's a good description on how to dose the remedy as well. So why not give it a try? In many ways, if you had a 50% success rate with the remedies you chose, that'd be fantastic. Fantastic. I mean, obviously, to be more successful and reliable in 70-80% success, you'd have to have a bit more experience. But 50% on any supplement or additional medicine given is pretty good. And therefore, I think anyone using the guide will get about a 50% success rate. So that may not be enough for some people, but I think it's worth giving a try. And at least a couple of choices, and sometimes you might have a backup of that remedy to choose as well. of another remedy.
Yeah. And certainly 50% is better than none. So, to kind of explore that a little bit I think is really, really valuable. And I've been a big advocate and user of homeopathy. I haven't traveled in nearly 20 years without my homeopathic travel kit with me. And I find it just such a simple and easy way of supporting myself. And, a few quick questions and, you can get some amazing change around in the body very quickly with that support. So I think it's definitely something that all of you listening in should check out. And we'll put a link into that in the description later on.
Thank you, Ben. Yeah, that's super.
No problem at all. And Jonathan, thank you so much as well for your time today. It's been really, really fascinating listening to you. And it's the first time I've really been able to listen to anyone talk more in depth about that value of homeopathy within Bowen Technique. And I've got no doubt that our listeners, our Bowen practitioners, are going to find that absolutely fascinating. And I'm sure that a number of them are going to be keen to sign up for your Homeopathy Simplified program when that's ready to launch. And so I'm just curious as we finish, if people want to learn more about you, where are the best places to send them to?
Well, I think, mostly homeopathysimplified.com would get them the information about me. And I do have a Bowen site as well called bowen-online.com, and that gives a good amount of information about Bowen. And in fact, it developed as a course for supporting the training I was doing. As so many students asked me for videos that I said, okay, I'll make some videos. And they've been tremendously helpful in accelerating their learning process, that they could just easily look up procedures and see how they're done and be refreshed. Because when you learn Bowen, it's a tremendous amount of information in a short amount of time, and you just can't hold that in entirety. And so to be able to question how to do a procedure and have an answer right away, that was the purpose of it. And it morphed into something more than that. And, there are practitioners of Bowen that have never taken a live class. They've only taken online training. And
Wow.
it's amazing how well they do. And you finally get them in the classroom. So, it's about how keen the student is, how driven they are to analyze and palpate themselves and practice on others in order to practice Bowen. And, it's an interesting process. I don't encourage people to solely learn online, but it is for those that are in remote parts of the world, that's an option. And there are obviously many other courses now available. So this sort of additional learning through what you're doing, Ben, is really invaluable for people. And I do wish I'd had that in my beginning. Yeah.
Yeah, me too. which is part of what's encouraged me to do this. Now I've got this position and opportunity to be able to do that. And of course, it wouldn't be possible without people such as yourself who are willing to give time and share that knowledge in the very generous ways that you do. And all of us in the Bowen world are really, really grateful for that. And it's what helps drive the practice forward and what helps what I feel is the aim that we all step into it for, which is a world that is in less suffering and less pain. So, we really appreciate that. And we'll make sure that we've got links to all your stuff down in the description. Jonathan, really big thank you for joining me today. And that we hope that everybody who's been watching along for this, thank you for your time and attention listening into this conversation. And we hope you've had a lot from that as well. Thanks, Jonathan.
Thank you.